Hi, folks. Welcome to episode 6 in this second series of the lectures on teaching strategies in physical education and health for pre-tertiary schools in Ghana podcasts. This series 2, episode 6 is titled Leading School-Based Health Promotion Campaigns. Past name. This is a welcome message in GA. Mima obibia akwaaba eba physical education and health instruction podcast weiso. This is another welcome in Akan. So welcome to episode 6 of series 2 of the teaching and learning strategies in physical education and health for pre-tertiary schools in Ghana and African podcasts. In the last episode, if you remember, we tried to examine the importance of monitoring, evaluation, and impact assessment in enhancing the quality and credibility of physical education and health. Today, we turn our focus on a practical and impactful extension of physical education and health beyond the classroom. School-based health promotion campaigns. How can we achieve that? Health promotion campaigns provide a platform for students to actively participate in transforming their health behaviors and those of their peers and communities. They also offer teachers an opportunity to foster leadership, creativity, and interdisciplinary learning through purposeful advocacy. As usual, this episode targets pre-service PEH teachers enrolled in teacher education programs and in-service teachers in early childhood, primary, junior high, and senior high schools across Ghana and Africa. Also, school administrators, curriculum planners, and policy advocates interested in physical education and health instruction. You are all cordially welcome to this episode. We normally start with some main ideas and key takeaways. And here are our main ideas and takeaways from this episode, number 6. First of all, let us try to understand what health promotion in schools mean. We can simply say it's a coordinated set of activities that aim to improve health knowledge, attitudes, and behaviors among students and their communities. We can also add on, based on participatory learning, peer education, and behavior change communication. Health promotion in schools align with Ghana's School Health Education Program, which is normally acronym SHEP, SHEP. So you see, health promotion is very important insofar as physical education and health instruction is concerned. Now, what are some of the benefits of school-based campaigns? And we're going to talk about 4 of them. It reinforces classroom learning through active participation, learning through play. It also strengthens school community partnership and provides leadership opportunities for students. It also promotes healthier school environments and culture. Another main idea is common health campaign themes that can be employed. One, personal hygiene and hand washing, which is critical for most of the diseases we contaminate within our communities and, in fact, in schools as well. Cholera abound in some places, and that requires some personal hygiene and constant hand washing. Another campaign theme is nutrition and healthy eating. We know that fruits and vegetables are all medicines. Physical activity and fitness can be another campaign theme that can be used. Adolescent reproductive health is important, especially at the latter junior high school levels and the senior high school levels. And then lastly, prevention of substance abuse. We know these days our school athletes are either coerced or knowingly inject substances that interrupts their performances. Even though they may get instant gratification, in the long run, they are set forth for some other diseases. Now, let us look at some steps to plan and lead a campaign in your own community or in your school, or both. First, you identify a health issue relevant to your school or community. Not just any issue, but the one that is relevant. If, for example, here in Winneba, the coastal area is inflicted by cholera, you want to focus on cholera, and hand washing and hygiene will be key. You also want to set clear goals and objectives based on the target audience. So if it's the community, the fisher folks who live around, as well as the students who live along the coastal line and in the various schools. Now, you can form a planning team, and this planning team should include students, teachers, SHEP or school health education planners or coordinators, and some other health workers, those that can provide the needed information, knowledge, and skills for the students and the community. You also want to design engaging activities such as exhibitions, peer talks, drama, posters, jingles, fitness challenges. It could be a school-wide fitness challenge. It could be a community-wide fitness challenge. Then, of course, the most important, perhaps, is the mobilization of resources. Perhaps you may have some local NGOs, parents, school clubs, and health authorities who can come to your aid to do such a campaign. Now, the next is to implement, and then you monitor, keep track. So you track attendance, participation, and behavior changes. Then you evaluate the impact. By conducting surveys, you can do the surveys yourself or pick up a survey that is already in existence focus group discussion. There are focus group discussion templates that you can download, and then feedback sessions. Now let's turn to a case study. Clean Hands, Healthy Lives campaign in Tamale. A junior high school launched a hand hygiene campaign with support from the district health directorate. Activities included demonstrations, student-led peer talks, and posters in local languages. The impact: increased hand washing stations, improved hygiene behavior, and parental involvement. Where parents are involved, students are more likely to heed and pay attention to the campaign messages. All right, folks, these are the few things I wanted to share with you, but as usual, I will give you some take-home assignment or reflective activity to undertake on your own. Campaign planning task. Here, I want you to design a simple health promotion campaign and one health topic relevant to your learners. And in your plan, include the campaign's theme and objectives. Also, activities and student roles. How you engage the wider school community, and indicators to measure success. Here are a few reflective prompts, and I do so in the form of questions. What health issue in your school or community will benefit from a campaign approach? What partnerships or resources would support its success? All right, so what do you expect in the next episode, which is episode 7? In episode 7, we focus on navigating gender and equity issues in physical education and health. We will explore how PEH educators can challenge stereotypes, promote gender inclusive participation, and lead gender transformative practices in Ghanaian and African schools. Folks, let us continue equipping teachers to become catalysts for health, equity, and empowerment through purposeful school-based initiatives. This podcast was curated by Professor Kansi and hosted by Sain. If you like this episode, tell your friends so we can keep a sustainable conversation ongoing. You can also join my channel on WhatsApp. You can access that through my Facebook wall. Thanks very much for your support, but don't forget to visit our advocacy platform and just donate a cup of coffee, a small cup though, so that we can keep the conversation going. You can go to buymeacoffee.com. Buy me a coffee is one word, .com/rokansix/hosts. And you will see all the episodes there to browse and enjoy. Have a wonderful day. Bye-bye.